Meet Haley. She is a 17-year-old female struggling with bulimia. She uses laxatives and regurgitating her food to lose weight. Meet Allie. She's a 15-year-old female struggling with anorexia nervosa. She eats in secret and doesn't exceed 500 calories a day. Eating disorders are very common all over the world. At least 30 million people of all ages and genders suffer from an eating disorder. You will find that it is most common in teens. There are different treatment options when it comes to helping with this disorder. While you can be put on medications to help stimulate your appetite, occupational therapy can be a huge help. What is occupational therapy, you might ask? Occupational therapy is a form of therapy that gets you back to doing what you want to do, are expected to do, and need to do. OT looks at the mind and the body and everything in between. Occupation is any activity that occupies a person's time. Once a person starts to struggle with these disorders, they start to lose interest in their previous occupations. OT can come in and help a person to reestablish these occupations again through purposeful activities. Some occupational therapy interventions used for eating disorder is dissonance-based, which is a treatment approach that challenges society's norms or ideals. Mindfulness-based, which is a treatment approach that explores healthy coping skills such as journaling, meditation, or visualization. And psychoeducational-based, which is a treatment approach that educates the individual and individual support group on the effects of prognosis and resources for eating disorders. OT group and individual sessions use real-life activities as therapy. These purposeful activities may include, but are not limited to, planning and preparing snacks and meals, meal pacing, grocery shopping, clothes shopping, leisure and hobby exploration, socializing with peers during group games, planting and caring for plants and vegetables, money management and budgeting, time management skills, goal setting, developing volunteer and employment opportunities, becoming familiar with one's own sensory preferences. OT uses activities such as these to assist patients in defining and returning to the roles in their lives that are important to them. Establishing a connection to these meaningful occupations and roles helps individuals change the way that they think about themselves, their environment, and their recovery. Some practice settings that OTs might see a patient for an eating disorder would be outpatient, where the patient would come in for an appointment 1 to 2 times a week, intensive outpatient, which would be in a hospital or a treatment facility, partial hospitalization, which would be a day treatment clinic, where they would come 6 to 10 hours a day, 5 to 7 days a week, and inpatient treatment, which has 24-hour around-the-clock care. Typically, they stay less than 3 weeks